Do you realize that 1/3 of your health care dollar does not even go to health care delivery? It goes to advertising, it goes to accounting, it goes to business management, and everything and overhead and the like. 1/3 of your dollar. That is outrageous. It's a crime. It shouldn't be permitted to continue. In the House bill, we require that at least 85%, if not more, of the health care premium dollar goes to the delivery of health care. I frankly think it should be more, but at least we have a ceiling of 85%. If we have a public option, we can begin to keep insurers from seeing these inflation rates go through the roof. If we don't have a negotiated opportunity to bring costs under control, we have no leverage to keep the private marketplace from driving up costs beyond what the consumer can afford. With all of this said, it is remarkable to see that providers themselves, physicians, support this plan 75%. Why? Because physicians are sick and tired of spending all their time on bureaucracy, all their time filling out paperwork, all their time doing the business of business instead of the business of healthcare. That's why they want to have a plan that allows them to get back to their vocation. What is their vocation? To provide health care for their people. We already have government options and government plans. It's so interesting to see people attack public plans and public options. Anybody heard of Medicare? Anybody heard of the VA? Guess what? The VA is perhaps the best run, most efficient system out there. And frankly, any veteran will tell you that when they are able to get their health care at the VA, they are pleased to get it. The difference is we don't have the benefits reach high enough for those in the VA to accommodate all the veterans that we need to make sure are accommodated. That's the limitations of the VA. But for those that it does accommodate, it has always gotten great reviews. So we're going to do that, and because we do that, we're going to be able to do things that promote health care. I constantly hear about the donut hole in Medicare, forcing seniors to pay more out of pocket when they reach that limit, and then being unable to pay for their prescription drugs. So many of them having to make the decision between food and medication. And as a result, they get sick because they can't afford the medication their doctors tell them they must take in order to stay out of the hospital. Under this plan, we're going to close the donut hole, and close the donut hole here in Rhode Island for 19,000 senior citizens who fall into the donut hole every single year. We took an important step just 2 days ago in the House when we passed a bill to ensure Medicare Part B payments for 11 million seniors don't increase as they were projected to next year. That's the difference ultimately in these fundamental philosophical debate. The Congress this week passed a bill that froze Part B premiums. Do you want the public, through the members of Congress, ultimately to be the ones to regulate health care, or do you trust the private insurance market? They are accountable to the stock market. They are accountable to a board of directors. The public option is accountable to the members of Congress. The public option is accountable to the public. That ultimately is where you have to decide whose confidence do you have more in terms of who you feel will be more responsive to your interests. This bill is going to also reverse this last week, the 21% cut on physician payments scheduled for next year. And the Institute of Medicine report in this health care bill is going to look at the fact that Rhode Island is not in the same catchment area as New England for Medicare reimbursement rate for physicians. This is particularly important for Rhode Island because we lose a lot of providers to Massachusetts and to Connecticut and to out of state because the reimbursement rates are higher there than they are for Rhode Island. We train great providers and then they go out of state. In this health care bill, we seek to get that redressed. There's no reason why Rhode Island should not be held in the same catchment reimbursement rate for cost of living and so forth reimbursement as the rest of New England. And that is an important provision for the economy here in our state, where healthcare is one of the largest, if not the largest employer in our state, to have reimbursement rates reconciled with the rest of New England. And we do all of this and we pay for it completely. It's paid for through efficiencies and improvements, healthcare information technology, making sure you're not duplicated in your information, how amazing it is that doctors have to play defensive medicine. You constantly hear about how doctors pay high premiums and play defensive medicine on their malpractice. They would not have to do that if they knew that when they were making the decision on your health care, that they knew what medications you were on, if they knew that you just got an MRI last week, if they knew what your situation is. In this country, 100,000 people a year die of medical errors. Why? Because the physicians at the time of delivery don't know everything about your health care and have to wait days before they can consolidate your medical charts, often taking too long before they can make the proper judgment at the time that they need to make the judgment. With healthcare information technology in this bill, we're going to begin to be able to redress that and save dollars and more dollars and more dollars. They won't have to duplicate that blood test, that MRI, and so forth because they're worried about defensive medicine any longer. And in addition to that, we're going to be able to allow small business to now begin to participate in healthcare insurance because the pools are not going to shut them out. Here in Rhode Island, small business is the lifeblood of our economy. But they can't participate because they don't have the pools of insurance risk that they can spread. Under our bill, it has community rating, includes everybody, so they have the same opportunity to get affordable insurance that bigger businesses have traditionally been able to get. They pay on average 18 to 20% higher than other businesses because they have right now are restricted to just a handful of employees. If one of those employees has pre-existing condition, their rates go through the roof. If one of those employees is a woman, they have higher rates because insurers always charge more in assessing risks with respect to women because they add on maternity leave and they add on a whole host of costs with respect to that. That's the nature of insurance. That's the way they risk. So we're going to begin to allow small businesses the opportunity to be more competitive when they haven't been so far.